worked well for you last night and that you have awoken this morning in good health. So 2 weeks ago, we looked at the health benefit of sunlight for the brain and how it impacts our mood and so on. So this week, we're going to look at its benefit for the biggest organ of our bodies. Anybody want to unmute and just say what that one is? But what organ is the biggest organ of our bodies?
Skin.
Thank you. All right. So the benefit of sunshine for the skin. And we will explore what happens as sunlight hit the skin and how that impacts us. So the question is asked, what is sun exposure for the skin good for? So sun exposure for the skin has a lot of important benefits, not just for mental health, but for physical health also. Because we cover mental health, we'll be focusing more on the physical aspect of it this morning. So this range from increasing our immunity and maintaining immune health. It acts as a catalyst for calcium, phosphate, and magnesium metabolism in the body, and many other functions. It improves our mood. And sometimes the same people that you see in the winter time and they walk past you and looking all grumpy, in the summertime, this very person could turn around and see you and just randomly say hello to you. And that's because the sun just does something to us. It increases work productivity. It lowers depression and anxiety risk. As for from physical health, the benefit ranges from lower risk of osteoporosis and bone fracture. In women, it improves fertility and it helps with a better birth and pregnancy outcome. Sunlight, the benefit of sunlight for the skin is purported in many research to even lower the risk of cancer. And we know that this is because of the benefit of vitamin D that we get from sunlight. And so because sun exposure to the skin triggers vitamin D, and we know that vitamin D is dubbed the sunshine vitamin due to it being produced as a result of the skin being exposed to the sunlight radiation. Vitamin D is a fat soluble, is a fat soluble vitamin in a family of compounds known as vitamin D1, D2, D3. So your body produces vitamin D naturally when it is directly exposed to the sun. You can only get vitamin D from sunlight or from certain food. It comes naturally in certain foods, but you have some foods that are fortified with vitamin D. And so it is good to supplement with vitamin D to ensure adequate level in your blood. So vitamin D has several important functions, like I said. The most vital function is for calcium, phosphorus, and to facilitate immune health. So again, I will say getting enough vitamin D is important for bone growth and for teeth development. And it is shown that people who take regular vitamin D have better teeth because it strengthens your teeth. And dentists won't tell you this, but it strengthens your teeth. And vitamin D also, when you get the vitamin D that you get from the sun, it improves the body's resistance to many diseases. So when the skin is exposed to the ultraviolet beam from the sunlight, um, it induces synthesis of vitamin D in the skin and represent one of the many benefits of the sun exposure. The vitamin D that is produced in the skin via sun ray is called vitamin D3 or cholecalciferol, and it is metabolized in the kidneys and in the liver. Right there, there is just so much to say about the importance of vitamin D that we get from the sun as a result of being exposed, the skin being exposed to the sun. But because I am acutely aware of the fact that we don't have a lot of time, I'm just going to look at some of the benefits that we get, some additional benefits to what I've shared before. So in addition to the primary benefits, research suggests that vitamin D may, and I use, when you read the research and it used the word may, it is because physiologically we are all different, and what may work for me may not work for somebody else. And like I mentioned just now, that vitamin D is metabolized in the kidneys or in the liver. So if you have kidney or liver problem, then it will not metabolize effectively in your body. And that is why the word may is used when you use certain research, because certain medical condition can stop you benefiting from certain things. So again, as a vitamin D may reduce the risk of multiple sclerosis and many other autoimmune diseases. It decreased the chance of heart disease. And yes, it really does, because a low vitamin D has been linked to increased risk of heart disease, such as hypertension. And yes, blood pressure is a heart disease, heart failure, and stroke. It reduces the likelihood of having like really bad infection. Like, remember during the COVID era, it seemed like many moons ago, but yes, it was just, it seemed like yesterday as well, when COVID-19 wreaked havoc in our life. And recent review have found that low vitamin D contributes to acute respiratory distress. And research is now showing, post-COVID, research is now showing that people who had optimum levels of vitamin D in their blood were less likely to have been severely impacted by COVID-19. And I just want to share here that my mom, she suffers with asthma, and she sometimes has to use a nebulizer when she has a really bad episode. And during COVID, my mom only realized that she had COVID when she did the antibody test. And we know that obviously that the Lord protected her, but also she has always used vitamin D. I ensure that she uses it even in the summertime, twice a week or 3 times a week, depending on what the weather is like. I encourage her to take her vitamin D. So vitamin D in supporting immune health, people who do not have adequate level of vitamin D might be at increased risk of infection and autoimmune disease, like I said, like rheumatoid arthritis, and type 1 diabetes is an autoimmune disease, just in case you did not know, and IBD, inflammatory bowel disease. And I work in this area, and it's crazy to see the amount of people who are coming with IBD. And even Monday, I met this man, and he's having a really bad flare up at the moment. And I asked him, I said, "Do you take vitamin D?" And he goes, "No, I never take vitamin D." And obviously, you have to be careful how you give these advice, because I'm not a doctor and we don't know anything. But I advise him, just go and take some vitamin D. I said, because you're melanated, you need to take some vitamin D and see how it helps you. So in terms of supporting the bone density, vitamin D exposure regulates the absorption of calcium and other mineral like magnesium and phosphorus, which determine bone density. And this is because it is directly and meaningfully involved in regulating and maintaining these I mentioned before: calcium, magnesium, and phosphate homeostasis, which promote bone mineralization for better bone density, and it reduces the risk of demineralization, and which causes weakening of the bone and make you prone to bone fracture. So vitamin D, what are some of the factors that promotes vitamin D deficiency? So you are more likely to absorb insufficient vitamin D from the sun if you live in a highly polluted area. And when I read this, I said, Lord, help those of us who live in London. People who use sunscreen. And I see melanated people like ourselves, those of us represented here on the prayer line this morning, who use sunscreen. People who spend more time indoors. Some of us, we go from home to the car or to public transport, in the office, out of the office, in the car and public transport, and back inside. We never get exposure to fresh air, never mind sunshine. So we need to be intentional about being out in the sun. So those of us who live in cities or in area with high-rise building that blocks the direct contact and the direct ray of the sun, and people who have darker skin, the higher the level of melanin, the harder it is for us to absorb vitamin D. And therefore, like those of us represented on the prayer line this morning, we need to try and supplement with vitamin D. You find that females of a certain religious persuasion are also prone to vitamin D deficiency. I remember when I worked in GP practice, I've never come across a female from the Muslim community who had optimum levels of vitamin D. And like I said before, those of us who spend time from the house to the car and in the building, and from the building to the car and home, we are not being exposed. People with certain medical condition, kidney and liver problem, because vitamin D is metabolized in the kidneys and in the liver, then that could stop you from absorbing it. People whose diet is lacking in green leafy vegetables, because you need vitamin K to help to catalyze vitamin D in the body. And here is a caveat. I do not know how many of you know, but whether you are unwell, yes or no, you are entitled NHS England say that you are entitled to one full blood test every year. They mess because I always go to my GP for my blood test annually, run about my birthday time. They messaged me the other day to say your blood test is now due. Make your appointment. And I would say to you to make sure that you ask for vitamin D to be added to your request. And because I am not someone who I've never drank milk, which is purported to be good for the bones. I always ensure that every 2 to 3 years that I get a DEXA scan just to check the integrity of my bones. And I remember going back to my GP with the result. And the GP said to me, but how come you don't drink milk? How come you don't drink milk and your result is above the World Health Organization recommendation? I said, okay, there are many ways to get you to get strong bones. You don't have to drink milk, you know. So just to encourage you to get your blood test and to get your vitamin D added to that blood test. So question, is it good to take vitamin D every day? So if you have received a diagnosis of vitamin D deficiency from your doctor, they most likely will recommend that you take a vitamin D supplement. However, if you are severely deficient, they may ask you to take it in liquid form as that is absorbed quicker, or they may even find that you need to receive injection to get that in you rather quickly, because it acts as a catalyst for so many functions in the body. That vitamin D deficiency is such a dangerous thing for so many people. You should also make sure that you, in addition to taking supplements, that you get out into the sunshine. The sun is out now. Make sure you do that. So another question that people sometimes ask, is there a risk of getting too much vitamin D? Um, if you take excessive amount of vitamin D supplement, you may, and that's a very faint may, um, get take too much vitamin D. However, this is very unlikely to happen from exposure to the sun and from your diet. But because we are fearfully and wonderfully made, our bodies regulate the amount of vitamin D that we need. And so even if we take too much, our bodies have its way of getting rid of it. People will ask, so what are some foods that are highest in vitamin D? Some foods are, like I said earlier, they're naturally high in vitamin. Some food you can get it from, and some of them are not necessarily food that we eat, but some of them are. And so I'll just read out some from the list that I have. And I know, some people promote a vegan, vegetarian diet, but we have to be sensible. If being a vegan or vegetarian, if you're not looking after your health, you have to make sure that you do what you can to keep yourself well. So salmon is one, in essence, oily fish, salmon, sardine, herring, tuna. People take cod liver oil. It is beef liver, which I don't think we eat, is rich in it, but it's on the list. Egg yolk. Mushroom is naturally rich in this. I know some people said mushroom is not supposed to be eaten. The jury's still out on that. That's a decision that we make individually. And some mushroom are also fortified with ultraviolet light, um, um, uh, to help it to boost the vitamin D content of it. Milk, we know, is fortified with vitamin D. So is cereal, oatmeal, yogurt, and oranges, and some baby foods. But like I said before, it is hard to get enough vitamin D each day through sunlight exposure and from food. And because we live in a cold country, and now it is supposed to be summer, but we're still wearing jackets when we go out, we need to try and supplement. My advice is that you get your blood test, know what your levels are, and so you can make an intelligent decision as to how much vitamin D you need to take. The bottom line is vitamin D has many, many benefits for our bodies. Like I said, it reduced the risk of so many illnesses, autoimmune diseases, strengthened the bones and the teeth. And we don't want to be losing our teeth as we get older. So we need to make sure that we look after our health. Um, um, and again, it is hard to get enough through diet and the sunlight, because if we do not get enough exposure, so it is good to supplement. But I would say, because the sun is out, we were talking about it yesterday at work. Today is going to be 25 degrees. The sun is going to be out. Get out of the house and get into the sun. And especially in the morning time, the morning ray is best for you. So if you have to go to the shop, don't jump in the car, walk. And it is good to carry your shopping in your hand. You get some weight bearing exercise doing that as well. If you live close enough to work, do like me. I just walk to work in the mornings now that the sun is out. Leave home a little bit earlier and I just walk to work. But remember, above all things, the God who created us knows exactly what we need, and He has given it to us in the right measure. The onus is now on us to ensure that we take steps to benefit from the blessing that He has provided for us through the sun that He has given to us as a great light. I want you to have yourself a fantastic day. Thank you very much.
Amen. And I
Thank
should
you.
just
Thank
add
you very much.
and I would just add the disclaimer here now. These presentations are for educational purposes and is not meant to replace the advice of your medical professional. It is not to be construed as diagnosis, prescription, or treatment of diseases. Although some of us who present on this line, we are in the we are health professionals, but we are not licensed to diagnose and to give prescription. So God is responsible for the results of obedience of His lifestyle plan. So all who are hearers on this line and receive these information, please as you must assume all risk for your personal use and misuse of these information. Therefore, this disclaimer serves as notice to the receivers that he or she is free to seek medical attention, advice, treatment, and diagnose from a licensed medical professional.